Ladies and gentlemen, viewers and fans of the Saudi 2 channel, Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. First, I would like to wish you Ramadan Mubarak. I welcome you. I'm Dr. Anas Al-Khani from the studios of the Saudi 2 channel. I welcome you in our first episode of the program, The Health Show. The Health Show is a medical program which will provide a comprehensive medical approach or overview about sensitive health topics that are related to fasting in Ramadan. The program will be broadcasted each week, weekly. We will have a total of 6 episodes, 4 episodes during Ramadan each week, and then we'll have 2 episodes in Eid al-Fitr. And in each episode, we will discuss a theme that's related to that week, and we will use all medical experts in our fields, including consultants, specialists, and nutritionists, in order to provide a very good medical approach and overview about the topic.
Constipation refers to bowel movements that are infrequent or hard to pass. It is a common cause of painful defecation. It is also not a strange fact that people face it mainly during Ramadan.
Usually on iftar, I prefer to have a light meal, or else I will feel pain in my stomach accompanied by problems. In Ramadan, after the fast, I always feel hard pain and I feel like my stomach is heavy. Every time after the iftar, I feel annoying gas and constipation, especially when I overeat. I think it's normal on the fast to feel constipation because we are having just one meal a day.
Constipation during the fasting period is mostly due to the changes in the nutrition and lifestyle. The main reason behind constipation is the reduction of water in our diet. Therefore, most of the people aim to drink a big amount of water and juices after fasting in order to prevent constipation.
Due to the hot weather, the first thing I do on iftar is to drink a lot of water, as the body needs water to function well.
Water is very important during Ramadan. I drink big amounts of it.
It is well known that people whose diets include a good quantity of fibers are significantly less likely to suffer from constipation, as people, especially in Ramadan, are keen to eat fruits, vegetables, and whole grains, which are rich in fibers.
I'm keen to eat fruits every day because it compensates the water we lose during the day. Fruits are important in all the days, not just in Ramadan. We have to remember the slogan, "An apple a day keeps the doctor away." So eating fruits is very essential.
Perhaps the most common component behind constipation are pastries, as such foods are low in fiber. They are not digested easily through the gastrointestinal tract.
I think that pastry are hard to be digested, so that I prefer pastries that are thin. Pastries lead to serious issues in the digestion. I don't eat them at Ramadan.
Enough amount of fiber in the diet, leading an active life, and drinking plenty of fluids are of help in preventing and treating constipation. In some cases, you may go for a fiber supplement after consulting the healthcare provider. According to doctors treating the constipation, the both painful and frustrating problems start by watching the diet. For the Health Show, this is Luna Fredi, Beirut, Lebanon.
Today, our main topic is constipation and healthy nutrition in Ramadan. As we all know, constipation is a medical issue during Ramadan and fasting. And as we know, because of the decreased fluid intake and because of the fasting, we don't take too much food or too much fluids during the day, many people suffer of constipation. And that's why it's a great topic, and that's an important topic to discuss and increase the public awareness about it. And therefore, that's why we intended to start our first episode about this topic. First, we'll start with a gastroenterology report about this topic, which will give an overview about what's constipation, signs and symptoms of constipation, and the complications of constipation over the long term. We'll go to this report and we will be right back.
When defecation becomes very painful, accompanied with the sensation of incomplete bowel evacuation, and in some serious cases, when symptoms of bowel obstructions takes place, this is constipation. It is a condition of the digestive system in most cases. This occurs because of the colon has absorbed too much of the water from the food that is in the colon. The slower the food moves through the digestive tract, the more water the colon will absorb from food. Consequently, the feces becomes dry and hard.
The constipation is the inability of the person to pass a bowel motion within 24 hours, mainly. We can say 36, for example. At the same time, he may pass it within 24 hours, but it's hard to do it. It's not soft. This is mainly the definition of constipation.
According to specialists, bowel movement can be very variable. Usually it is still considered as normal when it's down to once a week, as constipation is not considered dangerous unless it's caused by a problem in the colon.
Mainly constipation is a functional problem. The cause is functional. What is functional? The way the colon acts, the constrictions and relaxing, etc. It's mainly functional. Either the colon absorbs at its end, absorbs lot of water, then the residual material becomes solid and difficult to pass out. Or it can be, we call it inertia, weak in its contractions. But it's a motility problem.
According to Dr. Ismail Sukaria, the gastrointestinal system specialist, the prevention of constipation, especially during Ramadan, involves making diet and lifestyle changes. This includes eating high-fiber foods, drinking plenty of fluids, and exercising.
Mainly, he should take a lot of water, fluids, and the kind of food that has two major components: fibers and fluids, water, vegetables, for example.
As Dr. also mentioned the kinds of foods that are prevented in Ramadan, which leads to constipation.
Degrade as much as possible the starches, pastries, the heavy food, spicy rice was common to eat in Ramadan.
Treating the constipation depends on the cause, severity, and duration of the constipation, and may include one or more of the following changes in eating: diet and nutrition, exercise and lifestyle changes, medication, surgery, and biofeedback. Seems like constipation is a very common problem to all people, especially in Ramadan, as watching the diet remains always a duty. For the Health Show, this is Luna Fredi, Beirut, Lebanon.
Ladies and gentlemen, welcome back. We have seen a gastroenterology report about constipation and its consequences on the long term. And here in the studio, I welcome with me Dr. Ahmed Turko. Dr. Ahmed Turko is a consultant of general surgery at the Kingdom Hospital. He's one of the few doctors who is specialized in proctology, and he's running his own proctology clinic. Dr. Ahmed, it's a pleasure to have you here. Welcome to the studio.
Thank you, Dr. Anas. It is my pleasure to be here. Thank you for inviting me, and Ramadan Kareem for all your viewers.
Thank you, Doctor. Dr. Ahmed, as we heard in the report, we've seen that there is some complications of constipation over the long term. And we would like, since this is your area of expertise, we would like to know more about these complications. We heard the terms hemorrhoids and fissures. Can you please elaborate, define what are these terms for us?
Sure. First of all, let me just highlight the long-term constipation complication of constipation. As per my specialty, hemorrhoids and fissures are one of the most frequent complications of constipation. First of all, hemorrhoids are like a lesion grow at the end of the rectal canal near the anus. This tissue are filled with venous vessels, and there's many causes of hemorrhoids. One of the most important cause is constipation. The patient is, in order to pass the hard and dry stool, he had to strain when he passed his movement. This straining is very important in establish this kind of tissue and let this tissue becoming bigger and bigger, causing complication at the near and the near future and in the long term.
Okay, Dr. Ahmed, when we say straining, you mean forceful ejection of the feces?
Yeah. Because of the constipation, the patient has a dry and hard stool. It cannot be moved easily and to be expelled outside the body unless the patient had to force himself to press and press during the bowel movement to remove this waste outside his body.
I see. And what about fissures?
Fissures are a tear or cut at the end of the rectum. At the half of it will be on the skin of the anus, and the other part will be at the end of the rectum. This tear happened because of the passing a hard, dry piece of stool. It called the edge, or one edge of this stool could be very sharp, can cut this, or passing this piece itself can overstretching the sphincter, causing this tear to happen. And once it happened, many complications will happen for the patient, and we'll talk about this maybe at the...
Yes, definitely. Okay, Dr. Ahmed, since we've defined hemorrhoids and fissures, what are the symptoms that the patients they present with? What do they feel when they start having hemorrhoids or fissures after prolonged constipation?
Let's start with hemorrhoids.
Okay.
For the hemorrhoids, the patient will complain of discomfort of the area. He will feel something maybe bulging from outside. He will feel it and maybe he will test it. Sometimes he will complain from discharge from the anus. At the advanced cases, the patient maybe will have acute pain while passing stool, leading to bleeding. This bleeding can be light bleeding of red light blood, or can be massive bleeding that force doctors to give him blood as blood transfusion in advanced cases. Yeah. This is the most frequent symptoms and signs of the hemorrhoids.
Okay. So if we want to summarize for the hemorrhoids, basically the patient will present with pain during ejection of the feces or expulsion of the feces. It might be associated with a small amount of blood or a heavy amount of blood.
Yes.
Okay.
And there is also, as I said, there is discharge also. There is discomfort while sitting long time on chairs. There is a feeling that there is something on the area which make the patient worried. What is this? Sometimes the patient will have what we call the acute attack of hemorrhoids, that the hemorrhoid comes out and become tender and cannot go down. The patient cannot sit. He has severe pain. This is an urgent situation that needs immediate medical support.
I see. And what about fissures? What about the symptoms of fissures?
Fissures, once it happened, the tear take place, the patient will feel like an acute pain at the area. it will the defecation either the passing of stool will be always painful.
Okay.
He will have painful defecation every time he go to the toilet. The bleeding can happen also because of the tear, especially for older people who took blood dissolvent that like aspirin.
Okay.
They may have massive bleeding. And there is also the complaint of burning sensation in of the area while passing stool. This pain can last for many hours after defecation.
Okay.
And this is really a very miserable situation actually.
I see. So, Dr. Ahmed, we can see that probably there is a relation between hemorrhoids and fissures and the symptoms. I mean, you mentioned in both of them there is some discomfort, burning sensation, and also we said that in both of them we might have bleeding and also pain during prolonged sitting or defecation. So do they usually present together, or do they present like individually? Either we have hemorrhoids or fissures, or they might be together, hemorrhoids and fissures.
Actually, we can see both.
Okay.
Because the etiology of both most probably caused by constipation. So we have patients that they come for complaining of symptoms alike with both of things. By examination, we diagnose them as hemorrhoid, and the other, by examination, we find that they have fissures. And we have many of patients, they present with similar sign and symptoms, and by examination, we find that they have both of fissure and hemorrhoids.
So they might, as a
come together.
They might come together.
Yeah.
Okay. Dr. Ahmed, how can we usually, I mean, as a surgeon, how do we manage these cases? First, we need to, I mean, is there only a surgical approach, or there is a medical, or is there something, a lifestyle modification we can have before going into these, the medical and the surgical? Can you please provide us, from your experience, how can we approach these cases?
Once the patient presents in my clinic, we focus on the causes of his situation. If he has hemorrhoids or fissure, we search for the causes of these. There are many causes of the constipation. So we focus on the causes that led this patient to have this situation. For people who are working in a office job, they are sitting long time on the chair. So we advise them to change their lifestyle by not sitting long time and to move. Okay? There is also changing their lifestyle model by more exercising, to do exercise, to drink more fluids, water and juices and hot beverages, to increase the fibers. So there is many things to either we are going for medical or surgical treatment. We first focus on the changing lifestyle, because we need this lifestyle to be changed in order to get the long succeeded of this situation.
So since we have discussed the management in a lifestyle modification, we will go to a nutritional report, and we will stress on how nutrition is very important in preventing constipation and the complications of constipation. We'll be right back. Stay tuned. Dr.Razan, our theme today will be about constipation and how to avoid constipation in Ramadan during fasting. Can you tell us from your point of view and from your clinical experience, what are the most common mistakes that patients do during Ramadan and fasting which leads to constipation?
Hi, good evening everybody, and happy Ramadan to all. For patients or for people during Ramadan, they tend to forget to drink water. They like to rely on like coffee and tea and juices. While water is the best drink, they should, and especially this Ramadan is happening in the summer, and it is in the hot season, so they are very much prone to have dehydration through sweating and excessive sweating, especially if they go out in the sun. So the best thing is to avoid this dehydration by drinking water. As we know, for example, tea and coffee are like diuretics, so they can also cause the body to lose more water from cause them to lose water. So it is better to focus on drinking water. Also, the common mistake is that they really forget about having salads or having fruits and vegetables during Ramadan. They focus on sweets instead of fruits. They focus on hot meals and very fatty meals, basically baked goods and pastries such as sambusek and like pasta also, which is all very heavy, and usually it has very little amount of fibers. And fibers is very important in Ramadan because usually the meal time is different now in Ramadan. They are prone to have more constipation, so it's better for them to really focus on the high fiber intake. Now, what is the fiber and how can we get fiber from our food? Fiber is usually it's found in plant food. It actually makes the outer layer of the seeds and grains, and so it's actually found in vegetables, found in fruits, especially if they are eaten with their skin, and also found in seeds and nuts. And for example, the bread, we focus on brown bread because it has the whole grain, the whole wheat bread. It's not only brown by color. We should pay attention to that. When we buy the bread, we should not see the color of the bread. We should read the nutrition fact. The first ingredient should say whole grain or whole wheat bread. Also, we try our best to have brown pasta, brown rice. We try our best to have salads every day, and we try our best to have fruits as much as we can. Like, for example, fruits and vegetables, at least 5 servings a day we should consume. And the most important thing is when we have fibers, we have to drink with it water, because fibers absorb water. So if we don't give enough water for the fibers we're eating, the fibers will not give us the benefit, the whole benefit. If you want, I can tell you, for example, how much we can eat in the iftar, for example. Yeah, on the iftar, I suggest that having dates just to break the fast is very good. 3 dates with a cup of water. Even if they want to have juice, it's better to have half cup only, and then they can have like leban or low-fat leban or yogurt, and then they can have some rest, and then after prayer, after finishing the Maghrib prayer, they can start with the main meal, which I just said it should focus on vegetables. The plate should be half vegetables and full of fibers, and 1/4 should have some meat or any kind of protein, and the other should have rice. I would like to stress on taking extra glasses of water, especially in this season. Drink at least 8 to 12 glasses of water. Stay away from coffee and tea, and especially at suhoor, because they are diuretics. So also stress on eating fibers through vegetables and fruits, and also vegetables and fruits have a lot of water in them. Sometimes they are like 90% water, so they also add to your water intake. Also, like, they can have a lot of soup, They can have also nuts have a lot of fibers, legumes. So for example, they can have like a lentil soup. It's very good. Amount of fibers that you should take a day is 25 to 35 grams per day. And if you have like a half a cup of lentil a day, cooked lentil, it will provide you only this. It will provide you with 8 grams of fibers. So it provides you with a lot of fibers. So that's actually, and my stress also is to, I would like to stress on the leaving the amount or leaving the food that is high in refined and processed carbohydrates, not the complex carbohydrates. For example, the pastry that is made from white flour. Stay away from this pastry and make your own pastry with complex carbohydrates or brown flour.
Ladies and gentlemen, welcome back here to the studio with Dr. Ahmed Turko, consultant of general surgery at the Kingdom Hospital. As we have seen together, Dr. Ahmed, we've seen a report, a nutritional report, mentioning the importance of nutrition in preventing the consequences of constipation, which we already discussed earlier during the episode. We stopped at lifestyle management, and then we said after the report we'll continue with the medical management and then the surgical management. Can you give us, Dr. Ahmed, an overview about the medical and then the surgical management, please?
Sure. First of all, we use the medical treatment for the initial cases, for the primary stages of these, for especially the hemorrhoids. Also, we try to see if the patient will benefit from the medical treatment in the case of fissure. The medical treatment is mainly focused on sitting in warm water, sitz bath, and to use local anesthetic ointment on the area in the case of the fissure. There are many techniques of medical treatment, all focused on the locally treating the area with lifestyle change, as we said earlier.
Yes.
For the hemorrhoids, there is 4 stages of the hemorrhoids. So we try to focus on the first and second stage on medical treatment plus changing the lifestyle. Treatment of the first and second stage of hemorrhoids will consist on taking medication to minimize the size of the hemorrhoid, to take laxatives to make it easier for the patient to pass stool without any problem, and to sit in warm water and apply local ointment.
Yes.
We'll try first to see is this patient will benefit from these. If he succeed, we'll continue. If we try and we find out after following all the nutrition recommendation about changing his lifestyle with the medication that he will not benefit, then we will discuss with the patient moving to the next step, which is the surgical treatment.
So we can deduce from what you said, Dr. Ahmed, that first we go to the medical management and the lifestyle modifications before going into the surgical approach.
Actually, for the primary stages.
Okay.
But when the patient present with very advanced situation, we know earlier that the patient will not benefit from medical treatment. So will not waste time and going into complication. We try to go directly to get the maximum benefit of the treatment.
Okay. So probably we can say that if you, I mean, to the audience who are listening to us now, we can say that it's always recommended that as soon as you feel the symptoms, which we mentioned earlier during the episode, it is better to go and to seek medical advice, either from a gastroenterologist who might then refer the case to a general surgeon or a proctologist, and then or to a general surgeon right away.
Yeah.
In order to prevent further complications.
Totally true. The earlier the patient complain from these things, the best thing, or the earlier that he feel these things, the better he goes directly to seek medical advice in order not to go into complications.
Okay. Dr. Turko, what about the surgical approach? I've heard that recently in the kingdom we have advanced approaches, surgical approaches with laser therapy that minimize the symptoms and the consequences of hemorrhoids and fissures on the long term. Can you just give us a brief idea about these instrumentations and techniques?
Sure. Medical surgical treatment of hemorrhoids and fissure consists of non-invasive treatment and invasive treatment. We have, for treating hemorrhoids, we have more than 5 to 6 different methods of surgical treatment, invasive and non-invasive. The most advanced and new technique we started a few months ago to adopt in our hospital is the laser technique. The laser technique, contrary to what the people or your viewers believe or have any earlier believe, it is the surgery will do in this operation the same what we were doing in standard operations. Okay. The most important thing is we don't cut and make stitches. We just use the laser technique for burning this disease, this lesions, okay, and to make sure that it will not come back if the patient follow the instructions. The result of this, the patient will be free from about 2/4 of the pain post-op that will happen by using the surgical operation, and the healing will be faster. So the returning back to home will be faster, and the patient will feel much better and much happy to find out that this operation can be done without taking the risk of severe pain. Not patient earlier, they cannot get out of the bed for many weeks after the surgery. Okay. So this is the most important improvement of treating this kind of disease.
So a faster recovery and less risk of complications of the surgery, we can say.
Yeah. The faster recovery, the pain will be less, 2/4 less than comparing with the standard surgery, faster returning to work. If the patient follow the instruction of changing his lifestyle plus a good operation, the percentage of not having this again may reach about 95%.
Okay, that's what I wanted to ask before you mention it, doctor, is that the percentage of having the same thing again after the surgery. As we all know, all surgeries, they have a percentage, most of the surgeries, of having the same problem again. And what are the important factors you want to stress on for the audience, so we can deliver how, if in case one did the surgery, how he can prevent having again the same problem, which is hemorrhoid or fissures?
As I used to tell my patients, there is no guarantee not to have this again. There is no guarantee.
Always actually. No guarantees.
Yeah, till today there is no guarantee, because we are not comparing this with appendectomy or removal of gallbladder. Okay. Because once we remove this, it will not come back. But with hemorrhoids, the area that create this is still there after surgery. So the chance of having this again is there, unless the patient follow the instruction and change his lifestyle modality, not in order not to have this again, by changing his lifestyle. What was there of fissure or hemorrhoids, we can remove it by surgery, and other non-surgical treatment. But we stress on the patient to follow what, and we are giving brochures also and papers, what he has to do, what he has to avoid. So these things the patient has to follow in order not to get this again. This is my message that we always deliver to our patients.
I see. Dr. Ahmed, in a few words, can you just give us a final recommendation about to the audience about hemorrhoids and fissures in Ramadan? How can we just in a few words prevent having this, and we will conclude the session by having this few words from you.
Sure. In Ramadan, there is a long time of not having any food or fluids, and the time of it's allowed to take these food and fluids is less than the time is not allowed. So we need to concentrate on this time after futur till sahur, to concentrate on this time by taking plenty of fluids. When I say fluid, means water, hot and cold beverages, with juices, with tea, with all these things. We have to take plenty of them. The most thing that our viewers and people do in Ramadan, that they focus on food and sweets in Ramadan and forget about fluids, especially that the time of the high temperature is gone already.
Yes.
So we need to focus on getting more fluids, to mix our food with plenty of fibers. Fibers means a lot of vegetables and fruits.
Yeah, as we heard in the report, nutritional report.
And to know what things that cause hemorrhoids that we have to avoid, what things that facilitate passing easily stool, to just follow. This is the most important thing in Ramadan. If the patient has already his treatment, he has to continue his treatment. Always Ramadan accompany with constipation, for the reason I have said. So take care to take your laxatives in Ramadan, the people who are taking these things, to focus on taking minimum 2 liters of fluid daily. Focus on taking a lot of fibers, fruits and vegetables, salads, juices, all these things.
So in conclusion, we can say that prevention is always better than treatment.
Yeah, that's right.
And now we'll go to a report speaking about the conclusions of this episode. Basically, we have 5 main conclusions, which I would like to mention. First, we have the first conclusion, of course, we came across in this episode is drink plenty of water during iftar. So as we heard during the nutrition report and with our guest here, Dr. Ahmed, drinking plenty of water prevent and fluids constipation and help you facilitate bowel movements. Increase your fiber intake by eating plenty of green vegetables and salads. Also avoid all types of fatty food, including fast food and other fried meats. Increase your physical activity. As we heard also, it prevents having complications of constipation such as hemorrhoid and fissures, and avoid prolonged sitting and standing. And if you suffer of persistent constipation or pain in the anal area, just visit your gastroenterologist or your proctologist as soon as possible. And by this we conclude our episode. I would like to thank you, Dr. Ahmed Turko, consultant of general surgery and the Kingdom Hospital. It was an honor having you here, and I wish you a happy Ramadan. Would you like just to say a last word? And I would like to thank you very much.
Thank you very much, Dr. Anas, and Ramadan Kareem for you and your viewers. Just a home message. I want to say that constipation and hemorrhoids is very frequent disorders that affect in this area 1 out of 3 to 5 of the population. So it is not that small amount of patient. It is a very frequent complaint and disorders that affect a big percentage of the population, and the cost of treating this is very, very high. So focusing on very simple things of prevention, treating this early as possible is the most important things to get rid of these conditions.
Thank you very much, Dr. Ahmed. It was an honor having you here, and By this, we come to our end of the first episode. Please don't forget to subscribe to our YouTube channel through the Saudi 2 YouTube channel on YouTube, and please subscribe to our Facebook fan page. And the last, before we go, we'll provide you with a report. Thank you very much, and I wish you a happy Ramadan and a blessed day. Thank you very much. This was Dr. Khani. Ramadan Mubarak.